all patients with hepatitis B, it is noted now that 43% of the patients with cancer in the liver is due to hepatitis B. So you can understand that it is a very important issue in patients who develop cancer. Apart from this, now we come to prevention of hepatitis B. We advise people that they go to centers for any surgical, dental treatment at sites and hospitals where cleanliness, especially high standards, are maintained. This is very important to prevent the hepatitis B. If a person is vaccinated, they are protected. There is no doubt about it. So prevention is better than cure. With regarding to other safety precautions, it is advised that they have safe sex and to reduce or do not involve in IV drug abuse, because sharing of needles can transmit not only hepatitis B but other infections like HIV, hepatitis C also, and it can be compounded by taking alcohol, which can double the risk of liver disease. So all of us can live a healthy life by prevention of this hepatitis B and to reduce the intake of alcohol, to compound and to reduce the effect of these diseases on the liver. In conclusion, about the message that I want to pass on Hepatitis Day is that education is important, and to prevent the disease, to spread the information to people whom we know about hepatitis B, to make sure that everybody is vaccinated. If they have turned out positive for some reason, that they do not have to worry, but they have to be under care of specialists. I sincerely request all my viewers that not to try alternative therapy, because it can compound problems. These medications, we are not sure how they affect the liver, and patients can present with acute liver failure and who may end up having an urgent liver transplantation. The cost of liver transplantation is huge. The cost of human body, it is assessed, it is supposed to be $3 billion. And even if we take the cost as $0.3 billion as per Indian standard, it is worth crores of rupees. So we have to look after this asset which is given by the God to us, to look after this body and to make sure that we live happily, healthily, and for a very good futuristic India. Thank you. Namaste. I am Dr.Suresh Singhvi, Senior Liver Transplant Surgeon, Sir Ganga Hospital, New Delhi. Being Hepatitis Day, I am trying to bring awareness about hepatitis B and to reduce the incidence of hepatitis B in India. The incidence of hepatitis B in India is 4% in the general population. It varies from 2 to 7%. So as we can imagine, in a population of 120 crores, we have 4%, which is 4.8 crores, which is a huge number. It is an endemic disease, and hence we have to reduce the incidence. The reason for spread of this disease is because the people transmit the infection horizontally, which is like where they share toothbrush, shaving blades and other things which can transmit the infection. The other reason for the transmission of the infection is because long-term treatment compliance is not followed, and hence over a period of time an infected person can transmit the infection to his spouse and to his children as well. Apart from the infection being transmitted horizontally, the infection can be transmitted due to various other reasons as well. It is because of injections, by drug abuse, sexually transmission, and also acquired to various dental and surgical treatments. So coming to prevention of this disease, the vaccination which has been started in the general population during childhood or during the newborn will reduce this infection over a period of time. This blanket treatment was started in 2014, and hence this will take 15 years to reflect to reduce the incidence in India. We can do our bit by reducing the infection to make sure that everybody gets vaccinated if they have not been vaccinated. The other problem with hepatitis B is, apart from causing cirrhosis and chronic infection, the compliance of medication is very important. Long-term medication is very important. government institutions and private institutions are helping the people to make sure they get the medicine, especially in low economic strata. This is very important because the cost of medicine can be quite significant in the poorly socioeconomic status. With regarding to the causes of problems in the future with hepatitis B in chronic infection over a period of time, they can cause hepatocellular cancer, and most of the patients who present with cancer are usually inoperable or they are not detected early, and hence their life is cut short by the advanced cancer. So to prevent this possibility, we request the patients to be seen regularly by a physician or a surgeon who is good in managing hepatitis B. So this is very important because lives can be saved and it is preventable by taking long-term medication.